There is a lot of pain out there in the world, but I gotta tell you that birth pain is different. And when my appendix ruptured, I suddenly realized all the different kinds of pain and how it really varies. So today I'm gonna talk about how birth pain is different, how you should look at birth pain, and this might help you pivot to a really positive place. Now, I wanna say this is from my experience of seeing thousands of patients in labor, but I actually also worked hospice, I worked geriatrics, I worked pediatrics. So I've seen people in lots of different kinds of pain, not just labor pain, because your girl is old and experienced. Okay, so let's talk about pain. We know that if you put your hand on a hot stove, the pain of it burning is telling you to move your hand away, okay? Helpful pain, right? Not so helpful when you have the burn later on. When I had my appendix rupture, that pain told me you need to go to the hospital now, otherwise you're gonna die. And so again, very different pain. The pain was not helping it to resolve, right? The pain would have gotten so bad and then I would have died with my appendix. If you just leave your hand on that burner, it can get really bad. So those types of pain are alerting you to do something, but labor pain is really different. And that is because it is created by our good friend here, the uterus. I hope yours is also crocheted. Birth pains are expected. You know that this is going to happen versus like an appendix or other types of pain that aren't expected. You don't know why they're going on. But labor pains, especially as you're heading into 40 weeks, you know what's going on. Your body needs to expel that baby before it gets too big that you can't push it out. And if you're like, Hillary, I don't even know what to expect, I actually have a birth class that I recommend. I'm going to link it down below because knowing what to expect is always awesome. And if these pains didn't happen, it is true that your baby would get too big and you wouldn't be able to have it outside. So in some ways you should be grateful for them because it is pushing that baby out, although it is hard to be grateful for something that absolutely sucks when you're in it. Now, the cool thing is this uterus can ultimately produce the outcome that you need. My body couldn't do that with my appendix rupturing. But this uterus, if it does its job, which it most often does, will get the baby out and will start to heal itself. Like, it's amazing how birth happens, even though it's also very painful. It's hard to notice how amazing it is, but from a distance, you're like, wow, this really does work most of the time. The other weird thing about this is you have to relax into it because this is part of your body. And if your cervix is tight and you're like, oh, this hurts so much, which is our normal reaction to pain, your body can't relax and help that baby to descend. You got to remember that this uterus is living here amongst your pelvis that doesn't want to stand up today. And there's like a whole bowl of your pelvic girdle or your pelvic floor that are helping to support the uterus. And again, if all of those muscles are hating their life and you can't relax, the baby stays up high and can't descend into there because you got to have those muscles relax. So it is a pain that you have to relax into. Again, very different than my appendix pain. It wasn't relax into this and just stay home and get septic and die. It was get moving, alert, alert, alert. You got to get this taken care of. Very different than labor pains. By the way, learning to relax into this is part of natural pain management. Again, the birth class that I recommend has a whole natural pain management bonus video. I'm going to link that class down below. And finally, labor pains, you get a break. So contraction, contraction, contraction goes away. You have a couple minutes and then you get that contraction again. So it's annoying, but you do get those breathers in between. They're expected and it helps you just really return to baseline and it gives you a time to have a breather before the next one. Now, learning natural pain management to help your body relax is so important, but I'm here to remind you that it should not be the biggest part of your birth preparations. There's a whole lot more. I actually have a whole video on all the things you should be learning beyond natural pain management. I'll link that one down below as well. Now I'm like, this is the best pain ever. It's going to help it resolve. But this pain can be really scary if you don't know what to expect. If you don't know how labor is going, or even that you're supposed to be in pain, which I've had patients who didn't know was going to be painful. So make sure that you are getting prepared with a good birth class to kind of know what to expect from this uterus and your body as you go through labor, because I do not want you scared. It's really easy to get afraid of the pain. So I actually have a whole video on if you are afraid of birth pains that I'm going to link to up above and down below. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth. I'm so glad you're here.